Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. RTA, that is a renal tubular acidosis. Now let's look at its characteristics. So first we move on to the hypokalemic RTA, renal tubular acidosis. So let's look at the hypokalemic variety. So hypokalemic variety, there is again two varieties, that is type 1 and type 2. Now let's look at type 1. So in type 1, the primary defect, it lies in the impaired distal acidification. So there will be a impaired distal calcification, distal acidification. And what will be the plasma HCO3? So when you look at the plasma HCO3, this is going to be less than 15, that is 15 milliequivalents per liter. Now what about to watch the full video, please click on the link below and it will redirect you to the main video.